Good morning, good afternoon, good evening, wherever you are, and thank you for joining us today. Welcome to this webinar session on the big catch-up in Madagascar. The session is recorded today, and you can listen to it in French. I'm going to say that in French as well. But before, if you want to listen to the session in French, please click on the globe icon that is at the bottom of your Zoom window and select the language in which you'd like to listen to this session. I'm going to say that in French now, very briefly. Vous pouvez donc écouter cette session en français. Pour cela, écoutez, vous pouvez cliquer sur le globe en bas de votre fenêtre Zoom et choisir la langue dans laquelle vous voulez écouter la session, donc français pour cela. We'd be happy to know who's with us today. You can already introduce yourselves in the chat box and tell us your name and where you're from. You can also use the chat box if you need any technical support. I'll do my best to help you. So if you have any question during this presentation, please use the Q&A box. It's available at the bottom of your Zoom window. You can ask your question really at any time, and our panelists will answer them after the presentation during the Q&A session. So I already said that, but this session is recorded and we'll share with you the links to the video as well as the slides by email, probably early next week. I hope you'll enjoy this session, and I'll give the floor to Sarah. Sarah, the floor is yours.
Great. Thank you very much, Alex. Good morning, everybody. My name is Sarah Wanyuike. I am the focal point for vaccine preventable diseases in East and Southern Africa. Today, we are starting a series of webinars where we hope we can learn from each other on the ongoing initiative for the big catch-up. And so today, we are hoping that we'll have an engaging interactive session with the Madagascar team. The Madagascar big catch-up efforts were launched in April, and so we've had some time for them to actually experience the realities of implementing catch-up efforts, as well as some of the challenges, some of the successes that maybe they'll highlight for us during this session. And so without further ado, I want to open the floor for Aaron Wallace to first walk us through the global overview of how we are doing in the region on catching up on zero-dose children, especially looking at some of the recently released data, as well as some of the guidance we have on how to monitor catch-up efforts. So over to you, Aaron.
Thanks so much, Sarah. Greetings, everyone. My name is Aaron Wallace. I'm with WHO headquarters, and I'm part of the headquarters team that's supporting big catch-up at the WHO and UNICEF levels. And so I'll be providing a bit of a quick walkthrough on big catch-up monitoring. Before we jump into a bit of the detail on monitoring itself, I wanted to provide a bit of the big catch-up context within which we are operationalizing the big catch-up. Now, within the African region, we've seen a fair level of improvement since the impacts of the COVID pandemic in terms of DTP1 and DTP3 coverage, where we saw a dip from 77% in 2019 for DTP3, and then a improvement by 2023 to 74%, and same with DTP1, where we saw a improvement to 83% for DTP1 this past year, which equals that level that we were at in 2019 for the African region. However, we do see that the number of zero-dose children within the African region is roughly about 500,000 higher in 2023 versus where we were at in 2019. Now, because we had this dip in DTP coverage for the past few years, we've seen this substantial increase in the cumulative number of zero-dose children since 2020, and this has rapidly expanded our immunity gaps and the risk for outbreaks within the region. And we are off track on the IA 2030 zero-dose target, which is the target to reduce the number of zero-dose children in the African region by half by 2030 from where it stands in 2020. So we do see this need for implementing these catch-up vaccination activities. Now, specifically for Madagascar, we have seen a certain measure of good success in reducing the number of zero-dose children from where they stood in 2021, where they had roughly 300,000 zero-dose children, to a decrease in the number of zero-dose children in 2023 to 250,000, which is great to see for the Madagascar team and for the country. However, that being said, Madagascar still stands as having the 5th highest number of zero-dose children within the African region at 251,000. And this still indicates the need for a strong focus on strategies to reach zero-dose, both moving forward, as well as the cumulative number of zero-dose children. Again, emphasizing this need for doing strategies such as the Big Catch-Up initiative. Now I'm going to touch a little bit on the monitoring specifically for Big Catch-Up and what's been developed around Big Catch-Up monitoring. Roughly about 2 months ago, the IA 2030 Data Strengthening and Use Working Group officially put out new guidance for monitoring catch-up activities. And this includes both doing catch-up as an essential part of immunization programs, as well as specifically within the context of the time-limited Big Catch-Up activities. And within this guidance, the content includes opportunities for how to deliver catch-up vaccination, how health workers can determine eligibility for when children need to receive catch-up doses, how health systems should be adapted to ensure that those catch-up doses are recorded and reported upwards, as well as specific methods or activities that countries can do to monitor and evaluate the progress on their catch-up activities. And lastly, a list of different monitoring indicators that are suggested that countries should incorporate into their health information systems. Now, for the country-level monitoring and learning approach, what we see here is the need to be able to ensure that various different activities are in place for, actually, just let me stop for 1 second. I'm just checking to see, Elias, I think we're sharing your screen. Can you back up for a second? Great. Just to lay out the proposed different approaches for monitoring and learning through the Big Catch-Up. What we lay out here in this particular diagram are recommended M&E activities that countries should be considering for tracking progress on implementing Big Catch-Up. This includes doing rapid convenience monitoring or rapid convenience assessments, lot quality assurance sampling, or LQAS, right after they've implemented Big Catch-Up immunization activities as a rapid approach for identifying the quality of the implementation of those activities and ensuring that, if needed, any adjustments can be done leading into the next immunization activities. We also suggest that case studies be conducted by countries to be a deep dive to understand how well the Big Catch-Up activities are doing in terms of permanently changing systems, and also to be able to document where barriers may exist in health workers and the entire health system is in terms of being able to implement catch-up activities. And this really is an opportunity to document lessons learned around permanently institutionalizing catch-up vaccination as an essential part of immunization programs. Next slide. I wanted to touch a bit on one aspect of the M&E activities for Big Catch-Up. For those countries that have received Gavi doses for Big Catch-Up, there is a Gavi BCU monitoring form that has, it's meant to be light touch. It has roughly 19 indicators in it across 4 sections. And the idea here is that countries would provide information through the various different regional channels upwards to the Gavi Alliance on various readiness indicators, various results indicators. Next slide. Also aspects around whether the countries have conducted any assessments that are specific to Big Catch-up. This includes those rapid assessments following Big Catch-up activities, as well as any broader scale household surveys that incorporate, say, for instance, behavioral and social drivers questions to better understand barriers to uptake of catch-up doses. And then also questions around program learning and adaptation. These are open-ended questions where countries can provide information on the key successes and challenges that they have faced in implementing Big Catch-up activities. Next slide. Just a quick overview of the Gavi BC monitoring form submission timeline and process. The first quarterly submission is due at the end of Q3 2024. And so we anticipate that countries will be submitting these forms in the month of, essentially in the month of October at the end of the Q3. And there'll be 6 submission periods, so each of the quarters after Q3 of this year, all the way through the end of Q4 of 2025. WHO has taken on primary oversight of this monitoring form submission process, and we'll be working closely with UNICEF and with the RWGs to facilitate the submission process. And as an overview of the data flow itself, the submission forms would be flowing from the country Ministry of Health and alongside support from WHO and UNICEF country offices up to WHO regional offices and the RWGs for an initial review before they're submitted to WHO headquarters. So myself and others who are part of the BCU MEL group here at headquarters level, and then we will be populating it within a global dashboard here across the Gavi Alliance partners that are supporting Big Catch-up, so we can help. Okay, so that BCU monitoring form, I basically went through verbally, so now you see it on the screen there, and just as a quick overview again of the submission process, this will be through 6 quarters, starting in Q3 of 2024. And the data flow will be managed by WHO, flowing through to the RWGs and upwards to global level. And that will be managed by WHO headquarters on behalf of the Gavi Alliance. Next slide, Elias. One last thing I wanted to touch on before we switch over to the country presentation is on Big Catch-up case studies. So these case studies are these deep dive opportunities to document lessons learned on implementation of the Big Catch-up activities. What we really want to be able to understand is how well has the Big Catch-up impacted the health system in terms of permanent changes to policies, to activities around catch-up, and also to how it's benefited to reducing the number of zero-dose children in the country as well. So we have put together at the global level a standardized protocol for conducting these case studies. And these case study protocol and the sample tools are now available. We will be putting them onto the TechNet websites very shortly, and so partners and countries will be able to access them. We're very much interested at global level to help support countries on conducting these case studies, so please reach out to myself, to the RWGs and the regional offices to help us to facilitate supporting you on doing these case studies. And I think that's it. Go ahead. Yes. So I'll turn it back over to Sarah for the next steps.
Great. Thank you very much, Aaron. And really sorry for the people who missed some of the slides. What we'll do is we shall share the slides. And as Alex indicated, this is also being recorded. So it's also going to be shared by early next week. And then I just wanted to highlight Madagascar will be coming in to present. As you've seen from Aaron's slides, Madagascar has managed to reduce some of the zero-dose burden, but unfortunately, the cases are still there in terms of number of children who have still been missed with vaccinations. And so now we open the floor to our Madagascar country team to showcase some of the work that they've been doing to identify and reach the children who have been missed over the past few years with vaccination. So I don't know who will be presenting. Patricia, do you know who is presenting from your side?
Non, c'est Dr. Lalo du ministère de la Santé qui va
It will be Dr.
présenter.
Lalao from the Ministry of Health who will be giving this presentation.
Okay.
Thank you. Thank you very much for giving me the floor for this presentation. So we'll come back on the progress, the main lessons learned, our challenges, but also the solutions to improve the monitoring of the big catch-up. Next slide. So for Madagascar, our health system, according to our organization, has four levels: central, regional, district, and community level. So, of course, here we also have 6 pillars: leadership and governance, human resources, services, infrastructures, and inputs, and the information system and financing. We also have some representative health and vaccination representative at the level of the regions and districts. And of course, when we are lucky enough, we have more resources, and then we can have up to 2 people managing this. But in other districts or regions, we've got insufficient human resources. When it comes to consumables and vaccines, we have a quarterly supply chain and quarterly deliveries, but unfortunately, it remains unreliable and irregular. For the information system, we are currently organizing a reporting system for the data to be here integrated in the DHIS2, but we had several difficulties with the system. Next slide. So let me focus now on the big catch-up. For admin data, there is quite a gap between here the data that we have, and we managed to have an estimate of about 1,224,000 children here, zero-dose children in 2023. Madagascar, therefore, created a catch-up plan targeting children from 12 to 59 months using the Penta, PCV10, and here the other vaccines and combinations. We also then started with some intense vaccine campaigns starting in December 2022. Next slide. For our strategies, we were able to first share a directive coming from the Health General Secretary for the big catch-up. We also had a launch of this campaign, of this strategy, with the first lady of the country. That's the first picture you saw of this presentation. Then we were able to help the community health workers to strengthen the communication and to strengthen the routine program and organize additional immunization activities. Gavi also supported us with some additional supplies. And for the eligibility criteria for children between 12 and 59 months, this was for children a year that had never received, so there were 0 dose, so no vaccination, and then a year also based on the information here if there's been no booster and if the dose 3 hasn't either been administered. So what about the progress with our BCU? We created a weekly task force, including all stakeholders. We also created a guide, a Big Catch-up guide to help organizers based on the guidelines from Gavi. And we were able to organize additional catch-up activities with some targeted campaigns of immunization and also integrated immunization campaigns. We were also able, starting this year, to start training here in 12 regions of the country to explain what is this big catch-up. So we use Google Sheets for the weekly monitoring to make sure that at the district level, we have enough consumables and vaccines. We will also be able to create some maps for data collection. And for DHIS2, we were able here to break down into 3 categories the children between 12 and 59 months to have a better visibility. So let me show you here, because this is the updated tool that we use now, where we actually focus in children from 1 to 5 years. In our tools, from 1 to 5 years old, that's not something new, but it wasn't before broken down in 3 different categories. As you can see here, nowadays it is. Same thing for DHIS2. We have the same here bracket, the same category from 1 to 5, but again, we've divided here between 12 to 23 months and 24 to 59 months and 0 to 11. 3 now subcategories. So for this year, and also based on the estimated number of 0-dose children and this evolution from 2019 to 2024, we estimate here that we still have here the 1,224,000 children. We've decided, therefore, to analyze, of course, the challenges and see what we can do. We were able to catch up, and this year was a big catch up year. So we had a target, 35%. So that means 409,000 children, and we were able so far to here catch up on 299,000 children, which is not bad for our target, as of course we are about mid-year, and we are hoping therefore to be able to reach our target by the end of the year. So you can see here the numbers I gave you are in these tables. So next slide. So the main lessons learned from this BCU. So the Prime Minister's statement clearly stating that 2024 will be the immunization year was extremely useful. It shows commitment. And as I said, when we launch here the a big catch up, we also invited the First Lady of the country, which again shows that this is a national priority. We were also able to use instructions and operationalize these instructions. That means including the big catch-up in routine activity, have a good definition of the concepts of zero dose or under-vaccinated children, to integrate the big catch-up in all the mass activities. And that's how here we were able to emphasize the need and the significance of the big catch-up. For the tools, we were able to organize a unique data collection system for here vaccinated children, and how we can manage also the vaccines used in the routine vaccination and the big catch-up. And the big catch-up is a strategy, and it's an essential strategy to strengthen routine vaccination. So what about the challenges? We know that there is a difference at operational level between routine immunization and the big catch-up. And I just want to explain this challenge. So when you have two children coming in one health center, one is 0 to 11 months, and the other one in this second subcategory, 12 to 29 months. So what should the health worker do? Should we open two different vaccines for the same vaccine, or if it is for the pentavalent, or should we just use one single vaccine for both children? And then what about the monitoring? When it comes to the Gavi, the vaccines provided by Gavi. We also have some overlap when it comes to the operational activities. As you know, we don't have just immunization. The community health workers have also a lot of other programs to implement. So sometimes there is a kind of a overlap here with other activities, and that's really a challenge to have more time for the big catch-up. When it comes to also the data reporting, that's sometimes difficult. We have 114 districts, and only half manage to update the data on a weekly basis. The completeness of the data from the big catch-up in DHIS2 remains a challenge. We had a problem with the system, the DHIS2, and I will say it's getting better, slowly but surely. We still face some difficulties, and this has an impact on here the availability of the data. How are we going to acquire the vaccines for the coming years? As you know, the vaccines here that have been used so far for the big catch-up were provided by Gavi. But after that, what about the sustainability of the program, knowing that here for now it is a co-finance project? So far, the state has managed, the government has managed to co-finance, but this may have an impact on the availability of the vaccines in time. And also, what about the mobilization and to maintain this program? Sometimes this year, actually, we decided to strengthen communication, to raise awareness, explaining that we go up to 59 months for the catch-up and not only until 23 months. Next slide. So the solutions to improve here the monitoring of the big catch-up. So first of all, we published some very clear directive on the monitoring of the big catch-up vaccines. So we monitor batch numbers and also the antigens so that we can here have a better monitoring. We were also able to provide information in advance to have a clear timeline and have a better coordination with other programs. This is important when we talk about, for example, other integrated immunization activities that can be implemented at national level in coordination with other programs. Sometimes for districts that have a higher coverages, it's easier, but for lower coverages, districts, they can organize additional immunization activities that are very localized depending on the needs. We also shared some very clear instructions on here the weekly reporting using Google Sheets. So among the 114 districts, some really struggle also with their internet connection, which make it challenging to update a Google Sheet. But internet is not the only issue. Sometimes it's also about the availability of the data credits. And also we had some difficulties, as I said, with the DHIS2, the implementation as well of the national strategic plan and our communication plan. We've updated it this year. We were able to also validate it, and several activities have been implemented. And we also need to implement some routine communication activities in order to contribute to the visibility at community level of this big catch-up. And we need to include the needs here of the vaccines for the big catch-up in our forecasts. We didn't do it last year. This year we already integrated those for 2025. And that's been a challenge because it's the challenge is to acquire these additional doses. Thank you so much for your attention.
Great, merci beaucoup. Thank you so much, Dr. Lalao and team. I think that was a very useful presentation. I have to say, I congratulate you and the team for the significant progress you've made to catch up close to 73% of the initially targeted missed children in 2024. I'm also happy to say I'm a witness of the commitment from the country, from the national government, all the way from the president's office, the first lady, the ministers, in the launch of the big catch-up. We were part of the team that joined the launch. And so really encouraging to see how much progress has been made. Well, we also note some of the challenges that you're having for some of the districts that might not necessarily be performing as well as others. So maybe we can take questions from colleagues. I see we have a few questions that have already been posted. Maybe I'll start with the one in the chat. One person is asking, what exactly, what are the challenges with the data in DHIS2? Says, I'm curious about the challenges mentioned of not knowing whether to open separate vials of a vaccine for 0 to 11 months or 12 to 23 months. Is this because of a specific reporting requirement for big catch-up? I don't know if Dr. Lalao, if you're able to address that question, or the team that is with you, Patricia and others. Dr. Lalao? Okay, well, we wait for them to prepare. I see Magdi, you have your hand raised.
Yes, thank you very much. Thank you for the questions. So the challenge with the data first, with the HIS2, your first question. what happens is that we still have problems with the system. So the people in charge of entering the data in the DHIS2, sometimes they don't have a very good access. And at operational level, I think people are sometimes a little discouraged of using the system when they try and it's not working. And as I said, internet connection is a problem. So that's, of course, the difficulties. And still here for DHIS2, so when you don't have a very good internet connection, it's also problematic, obviously, as I said. And then I would like to come back to my example. You're right, with these two categories, 0 to 11 months and 12 and 23 months. It's not so much about opening here 1 or 2 vials, but if you are a community health worker, you have 2 children coming here, and you have these 2 children from 2 subgroups. What do you do concretely? Are you going to open 2 vials for one same vaccine? I always take the example of the Panta because here a vial is for several doses. So what do you do concretely in practice? So do you use just one vial from the routine batch, and you do the catch up with this same vial, or do you use a vial from the catch up to vaccinate both children, even if one is routine and the other one is catch up? I hope it's maybe clearer now here, but that's the problem with the data, because I think this was mentioned in the context of the data.
Okay, thank you very much, Dr. Lalao. I think that's very useful and definitely brings a very important question. And I see Magdi's hand is raised. So Magdi, I don't know if you want to address that also, or you want to add to it.
Yes, I'm glad here to be part of this panel. And before starting, I would like to congratulate the Madagascar team. As Sarah very well said, we can't hear Dr. Magdi. We can hear you. Dr. Lalao, can you hear me? So I think it's... okay, so now it's working. I was just saying, first of all, for our colleagues here, for the whole team and partners from the I-Alliance and the technical and financial partners, but also thank you so much to the highest authorities in Madagascar. As Sarah said, thank you here for this commitment at the highest level of the government, as the year 2024 was the year of a year immunization. So this is really about this work. So thank you so much, because I think this was really a positive dynamic that was implemented. Dr. Lalao, of course, we work together on the technical task force, and we've already discussed this, but opening one vial, it's not, of course, about opening 2 different vials here, because I think this is a very good question. For me, it's more about what is recorded. So the community health worker is going to just simply make 2 different records, one here in the routine process and one for the here catch-up. So it's not about opening two different vials, it's how you're going to record each dose. And I think we'll be able to rediscuss that because this is a very interesting point. You need someone really that is doing a recording with accuracy so that you are able to make the difference between a routine dose and a catch-up dose. And that's how you can make a difference without opening two different vials. Another question here that I saw in the chat, Dr. Lalao, how are we going to do further doses in the coming years? As you know, Gavi agreed on a fast track here for the catch-up of 35% of children by the end of 2024 and 80% of children by the end of 2025. So by the end of 2025, we should have restored here the performance of immunization and catch up with the routine vaccination, and therefore we shouldn't need additional doses after that. We would be falling into a normal routine management of immunization after this big catch-up phase. So I don't think that this is a real challenge if everything goes according to plan by the end of 2025 and that there is a catch-up and that we can catch up to 80% of zero-dose children. And I do believe it's possible for Madagascar. So should I stop here? There's a lot of very nice questions here. So maybe I'll give you the floor, Sarah, first.
No, that's very helpful. Thank you very much, Magdi. J'apprécie. I think there's the other question here about the guidance on the vaccines for the big catch-up cohort. I think you've addressed it. But of course, there is other question about the DHIS too, and how we capture.
Oh, if I may, on the DHIS too, on top of what Dr. Lalao very well said, I do believe that the server crashed in November 2023. So we've lost data. And of course, this has had an impact because up until May, last May 2024, now the system is back online, but you have to enter the data again. So we are in a recovery phase of the data, and I do believe that now it should work better. And sorry, let me think. I also wanted to come back on the Google Sheet weekly reporting. Dr. Lalao said it very well. There is a difficulty with Google Sheets. Out of 114 districts, only 50% of these districts are able to report the data in Google Sheets every week. Now we have to accelerate. As you know, in Madagascar, we are developing a new IT system for the management of vaccines and medicines. And I do believe that in 2025, we'll be able to rely on this system to see the availability in real time of vaccines down to the level of the community centers. And then I'll give you back the floor, Sarah. Thank you.
Great. Thank you very much, Magdi. I think those are very useful questions. I see, before I take the question with from Sahile, I hope I'm saying that name correctly, I will allow Jaria too. I see you want to add as well. Jaria too, over to you.
There are also questions in the Q&A. First question from Nadia Mitaina regarding the data from VAR2 in DHIS2. I don't think that this is a problem for the data collection. As Dr. Lalao explained, the target 12, 59 months is here divided in DHIS2 here into subgroups, so therefore that won't be a problem for the analysis. Other questions still in the Q&A box? I see another question from Francis. As we were able to rely on the support from the President and the First Lady, why was this important for their involvement? Why was it important? Are they still involved, or were they just involved in the launch? I think we are able to provide here to benefit from a continuous support. So the First Lady still comes over for some activities in the field. And of course, when she takes the floor, when she also conveys a message, she talks a lot about immunization. And in the coming weeks, we will also have some additional videos on immunization, talking about the big catch-up. And in these videos, we will be able to also see the statement from the First Lady. So it is a kind of a continuous involvement and support. I see a second question. What, if anything, did you do differently for the BCU in terms of messaging? I just wanted to say that for the BCU, there is a dedicated communication plan that was created. And here that for the routine catch-up or integrated immunization activities. And I also mentioned about the communication. Communication is key. And it's, of course, important communication. I'll stop here to, of course, give the floor to other panelists, also online, who maybe want to answer as well to some of the other questions. Thank you.
Thank you so much, Jariatu. I think that is very helpful. I don't know if anybody else on your team would like to address some of the remaining questions. We have a question here on the identification on the ground of missed children. And maybe we can also talk about some of the ongoing activities. For example, you have the polio campaigns, you have the measles campaigns that are also starting. And if there are any efforts to continue identifying missed children during these other activities for routine and campaign interventions. I don't know if anyone on your team is able to respond to that question about what is being done to identify missed children.
May I answer?
Wait, yes. Thank you.
Thank you very much. And I'd like also, of course, to thank Dr. Magdi. That's great to hear that it's not going to be problematic for 2025 for the big catch-up. And thank you for Dr. Jariatu as well for all this information provided. So now regarding the identification of the ground of the missed children, of the zero-dose children, we rely a lot on the community health workers at community level. We go through the community registers. We have what we call the community register used by the community health workers, and there's also here another register at health centers, in the health centers. And we try as much as possible to also conduct some door-to-door activities, discussing with parents, the community health workers are able to identify the zero-dose children or under-vaccinated children. At the level of health centers now, we also have a new directive to systematically here check the health vaccine and the vaccination status of the children. So every time a child goes to a health center, there is systematically the question asked about immunization. Therefore, if the child is fully vaccinated, if he's received all of the routine doses, so we listen to what the parents have to say, we check the documentation. And in the chat, I saw other questions. I believe I understood the question on there's only 50% of districts reporting back weekly. Here, the data. You know, here from these 50% of districts are those here in the Google Sheets. It's not in the HIS2, it's different here because not all the 114 districts are filling the data in the HIS2. Of course, since the crash, we had to create an Excel spreadsheet where each district can fill in their results based on the different activities conducted for the BCU or other activities like routine activities, integrated activities. Thank you. I hope it's clearer. Oh, and I'm sorry. Can I also give the floor to my colleague here, Dr. Patricia from WHO?
Yes, sure. Thank you. Thank you, Dr. Lalau.
Thank you very much. I just wanted to come back on the identification of missing children of the zero dose. I think this is key in the process for immunization. If we manage to identify the children, it's easy to vaccinate really from that point onwards. The difficulty before was to really identify these children. So we had routine immunization, but definitely this wasn't here enabling us to necessarily identify these children. And with some micro planning, we were able to go down to the village level, and this is documented now in each health district. And this disaggregated analysis shows here the different here coverage rates for each pathology. So we now have a good visibility on the different areas where we will find the most zero-dose children first. And then we also conducted additional polio vaccination campaigns. And during these campaigns, we were also able to have some activities dedicated to the identification of zero-dose children. And we rely a lot, as I said, the community health workers for routine activities and also for the identification of the zero-dose children. Lately, we were also able to use the geolocalization tracking system to localize here zero-dose children. And those are kind of complementary activities. It's extremely helpful. And this is also part of our work that we conduct with Gabby. Thank you.
Great. Thank you very much, Patricia. Very good to hear about some of the innovations also coming underway to leverage GIS technologies to identify these communities where the zero-dose children are, so that in future we learn and continue to make sure that we are reaching those communities. I think those are useful additions. Thanks also to Dr. Lalao for the clarifications and the additions. I had seen a hand raised, but I think it's been lowered now. But while we wait for other questions, there's one question here that's quite interesting about how to work on the messaging, especially when we're now showing that we're trying to reach the children we had missed, who had missed their antigens, especially in the first 12 months of life. Now we're going to go and vaccinate them between 12 months to 59 months. Is there any risk or anything we're seeing in terms of complacency with coming to the clinic on time for vaccination? Should we be reinforcing the message about the reason why it's important to be vaccinated at the national schedule for vaccination? I don't know if that question is clear. I don't know who would like to take that question from the country team. I think it's a very important consideration for these big catch-up efforts. Anyone? Dr. Lalao, Patricia, or Jariatu? Have you seen anything in terms of communication? All right, while we wait for the country team, maybe Magdi, I can give you the point.
I'm sorry, as you know, here we are kind of struggling here between the phone and the computer, so we don't necessarily have access to all the questions, sorry. But yes, I think I understood your question. So yes, we targeted the messaging. Of course, when we talk about BC, big catch-up, it is about catch-up. But of course, we need to continue to emphasize the fact that routine immunization should be between 1 and 12 months. And as I said, when we said earlier that 2024 was the year of immunization, that includes, of course, a routine immunization between 1 to 12 months. And that's also part of the message. So this is also included, all these messages are also emphasized. I think I see also other questions. So how do you manage to reach the zero-dose children during the BCU campaign, or do you also use a lot of routine activities? Well, both. For the BCU, all the strategies need to be implemented to really reach children from 12 to 59 months. It doesn't matter if it's routine activities, if it is your additional immunization activities. I hope I answered the question. But if it's not clear, if my answer isn't clear, please don't hesitate to let me know.
Okay, that's very helpful. Merci beaucoup. Thank you very much. Definitely very helpful to know about the communication also that's being managed in terms of one, it being an immunization year, but also reinforcing routine immunization. Magdi, over to you. I see your hand is raised. Meanwhile, we can take two more last questions and then we wrap up. Over to you, Magdi.
Thank you for the floor, Sarah. Sorry, I'm coming back on the previous question from Dr. and the answer of Dr. Lalao also. for us. This was very clear what the Dr. Lalao said. And really to prepare a whole integrated planning with micro planning activities so that districts are able to report on the activities that they've planned to strengthen routine activities on the one hand, and then activities to catch up. So the big catch-up activities is just that we have additional doses that we integrate in different strategies that can be integrated, or advanced strategies integrated in routine or mobile strategies. Let me give you a concrete example. That's maybe here's something here that we have to say works really well. We have very good coordination here between our technical partners and financial partners, and this works really well with the USAID, the World Bank, and I do apologize for all the partners here. I'm not listing, but the World Bank until the end of the year is financing 5 advanced strategies per month. And if they're well prepared with the mobilization of community health workers, that's how we can actually identify the zero-dose children and optimize these advanced strategies that will continue to be implemented until the end of the year. So yes, it's not two different things. It's not on the one hand the BCU, on the other hand the routine. It is something that has to be integrated. That's what I wanted to add. And another challenge for Madagascar is going to be the next campaign. So that's also part of the planning. And it's going to be about measles a year with polio. And the country is currently here trying to work with the technical partners on the field to optimize the same campaign that was postponed until early October, I believe, to identify at the same time zero-dose children. So when you verify the status of these children, we'll be able to identify more zero-dose children. Thank you very much. Sarah, you have the floor.
Thank you. Thank you very much, Magdi. I think those are very useful clarifications. And definitely, I think we're continuing to see more and more innovative approaches coming in from the country team. And you're absolutely right about the next round of periods alongside the planned measles campaigns. And I think this is a useful place to reflect on how these other periods have gone and how we can anticipate the next rounds will be going. So Jariatu, I see your hand is raised.
Thank you so much, Sarah. I just wanted to add something regarding the concern that was raised on communication. How can we have less zero-dose children? Because that's the impact. So we are vaccinating children up to 5 years old. So you can wonder, how will these be perceived by parents in the coming years? So the big catch-up will stop in 2025. There won't be any more catch-up needed. And I think that the first challenge is, of course, to strengthen routine. And also that messages have to be clear in the routine campaign. Messages to parents have to be extremely clear. We vaccinate children. We, for 4 years, are going to do a big catch-up because of COVID. We missed a lot of children because of COVID. Now we are strengthening the routine, and the benefit for the parents must be clear. That's really what is essential as a message. And this message has to remain clear for routine or for campaigns. In Madagascar, It's been about 2-3 years that we vaccinate older children. So we didn't start this just with a BCU. Based on the risk after the measles epidemic in 2019, and also the increase in the polio case numbers, we decided already a few years back to really vaccinate for polio and measles here up to 5 years old. So now we need to make sure that for other antigens, for penta or other antigens, to catch up on those. And if we manage to strengthen the routine activities, and Dr. Magdi talked about, of course, the supports we are lucky to have, I think we will have very few zero-dose children and under-vaccinated that will be older. So that's what I wanted to add on the messaging and communication. Thank you.
Thank you, Jariatu. I think that also is a good segue to the question. One last question I saw there on the chat, where somebody has asked if there are any discussions or any plans to any discussions about changes needed to routine immunization in Madagascar to be able to reach every child every year, even without big catch-up efforts. For example, increasing funding for outreach sessions, because a lot of these zero-dose analyses we've conducted, we've seen a lot of times that children are missed because either there's not enough funding support for the operationalization of outreaches. We continue to rely a lot on the routine approach where the families are supposed to come to the facility to get vaccinated. But the reality is that it's not always going to be the case. So are there any plans within the country to also address it so that we no longer have to take initiatives that are quite cost intensive in terms of big catch-up, but to really routinize identification and reaching of these children so that they're not missed every year after this? I think that's a very important question. There's also, while you're thinking about that, there's question policies for catching up missed children. So has the national policy been updated, especially to include PCV doses for the catch-up ages? Because of this is going outside of what is on the routine schedule, which requires a policy adjustment. Has that also been addressed within the country? So those are two last questions for the country team. Dr. Lalao, Jariatu, or Patricia?
Thank you for the questions. When it's about the financing, I would say that financing is sufficient right now. As Dr. Maddi earlier said, we have the advanced strategies in the routine strategy because it is financed by the World Bank this year. And we identified 56 districts out of 114 where we have more zero-dose children. So where we're going to have a year stronger support for the implementation of the different activities, and also in the big cities. So here we really have specific targets, like in urban areas, activities also financed by Gavi. This is about implementing immunization activities in cooperation, again, with community health workers, with the identification of zero-dose children. So you also asked the question on the change or update of the routine strategy. currently, we're taking this opportunity to give a better training to community health workers. So as I said, this year is a BCU year, so we want to really reach all these children, but this will continue until we have 0-dose children or under-vaccinated children. Yes, and I will also add, thank you, Dr. Lalao, but just to strengthen here and maybe answer to the other question too, at country level, we also have our immunization strategies as advanced strategies or routine strategies. So during this year, this big catch-up year, of course, we benefit from, as we said, additional financial and technical support. So we are using this support to train, to also motivate the teams. And that kind of creates new habits here in the health centers. So it's a kind of a change that is being witnessed or is being implemented in the field. Thank you.
Excellent. Thank you very much. I think that's very helpful, and I have to acknowledge how much effort you've put in place to launch the big catch-up, roll it out, and also to keep the momentum going. So I have to say congratulations once again for reaching the 73% out of the target for this year. But as you're addressing the questions, one thing that strikes me is a central role of the health workers and how much they're doing in terms of identification of the 0-dose children, how much is needed to support them so that they can continue to do these activities, including the trainings. It really speaks to how we work in public health. We cannot do this without our frontline workers who are everything to us in terms of identification of where the public health problem is and actually addressing it. So really appreciate that this is also being recognized in these efforts. Yes, Dr. Magdi?
I think there's another point, and we have to kind of learn our lessons. At the beginning of the presentation, you saw here a figure of 251,000 children, 0-dose children. So this was here one of the very first slides that was identified for Madagascar. But then in the presentation, from the country presentation, we talked about 1,224,000 0-dose children from 2019 to 2024. I just need to emphasize here that in the technical task force, we also discuss about how to make these calculations. And the technical partners should help to clarify what is the reference calculation. And the 75% here for the 2024 catch-up, they also take into account children that were here are also benefited from this catch-up without being in the big catch-up. So it's not a criticism. It is just to say that we maybe need to be careful with the data we use. What's the benchmark? How we can do a good monitoring based on which data? So we need to be very clear so that we can really track the monitoring and make sure that by the end of 2025, we reach our targets. But really, sincerely, my congratulations to the Madagascar team. And I'm extremely proud to be part of this task force supporting here the vaccination unit, and I do know that they're going to continue and keep up the good work. Thank you, Sarah.
Yes. Go ahead. Is it Dr. Lalao?
Thank you. Thank you so much, Dr. Magdi. I see another question. What happens in the center when the routine immunizations are out of stock, but vaccines from the BCU are available? What is important is to reach the targets. So it can be with the routine vaccines or BCU vaccines. What is important here is simply about vaccinating and then have a good recording system. Thank you.
Okay, thank you very much. Thank you so much for that clarification. Yannick, just hold your hand right there for just a minute. I wanted to ask Aaron Wallace to maybe, Yannick, I'll come to you in just 1 minute. I wanted to give a minute to Aaron to address a question that has come up from Magdi about the numbers, especially looking at the Madagascar numbers versus the WUNIC estimates. These are the WHO UNICEF national estimates of immunization coverage. Maybe Aaron, I don't know if you'd like to just make a quick comment on that while we look at this slide on the targeted children.
Thanks, Sarah, and thanks, Dr. Magdi. Just a very brief comment on it. The 250,000 zero-dose children from Madagascar that was presented earlier is just for the year of 2023, but the figures that the country is utilizing are figures that are the cumulative number of zero dose over that 2019 to 2022 period. And so that is roughly that figure that you presented, the 1 million plus zero dose children, which is also from the WUNIC estimates, if we add together those multiple years, would also be roughly that same number as well. So just want to clarify where that figure is coming from, that it's just a single year estimate for zero dose versus the big catch-up target being a multi-year estimate and target figure for all the countries during big catch-up. Thanks, Sarah.
Great, thank you, Aaron. Thank you for that clarification. So I think it's good that we understand definitely the sources of the data, and we're trying as much as we can to encourage and support our member states to use the best estimates available. Of course, it involves looking at different sources of data. But the good news here is the numbers presented by the country are very similar to the ones that come from the WUNIC estimates. So there's not too much significant difference. But I had seen a hand from Yannick. I don't know if you'd like to take the floor for a quick question. Okay, maybe not. Okay, I guess if there are no other questions, what we can do is, I think we can first of all recognize the preparations. Sorry, one last hand. I'm trying to see who that is. So many participants is scrolling up is tricky. Okay, Yannick, you can have the floor for just 30 seconds to 1 minute. Then we can wrap up the call. No, or maybe it's, we call that an acute flaccid paralysis hand maybe. All right, so I think we can acknowledge the efforts that have been done by the country team. Really, thank you so much, Dr. Lalao and the team for preparing for this presentation today. It has been a very useful learning experience. We've all been talking about big catch-up, but being able to see the results from your efforts is very encouraging. I think I'd like to emphasize what Magdi raised about also being careful with our numbers so that we can ascertain that indeed out of the 1.2 million children we had missed, these are the numbers that we're reaching. So it means we keep looking at ourselves and keep looking at how we're evaluating these numbers. And it's really encouraging to see the various data tools, the Google Sheet, the DHIS, and also just to acknowledge the partner support that has been put in place to support Madagascar to reach, to identify and reach the missed children. So thank you so much to everybody who has been on this call. It has been a very useful learning experience, even for myself. And I hope you've all found it as useful as we have. And we will continue to remain available to support the Madagascar country team. So Dr. Lalao and team, we are available, WHO, UNICEF, JSI, PATH, BMGF, World Bank, Gavi, of course. We're all available to support as needed as you prepare for your next round of peries. So don't hesitate to reach out to the partners. And also partners, we welcome any follow-up questions you have. As Alex had mentioned in the beginning of the call, this call is being recorded. So we will also share the presentations from the call, and looking forward to continued interactions as we continue to try and learn from this huge initiative in our region. Thank you so much, everybody, and bon weekend. Merci beaucoup. Au revoir.